Bismillahirrahmanirrahim. Today the topic of discussion is lymphoid neoplasms, and first of all I will discuss mainly the classification of lymphoid neoplasms, WHO classification. WHO classification. Mainly the lymphoid neoplasms, they are of 5 varieties. First is the precursor B cell neoplasms and peripheral B cell neoplasms. Then third is precursor T cell neoplasms and peripheral T cell and natural killer cell neoplasms. And the fifth is Hodgkin lymphoma. Hodgkin lymphoma. So, according to WHO classification, lymphoid neoplasms, they are divided into 5 categories: precursor B cell neoplasms and peripheral B cell neoplasms, precursor T cell neoplasms and peripheral T cell and natural killer cell neoplasms, and the Hodgkin lymphomas. There are further different examples of each. I will give you one example of each. Like in precursor B cell neoplasms, there's mainly B cell acute lymphoblastic leukemia, which is also known as ALL. It is mainly the B cell acute lymphoblastic leukemia. In peripheral B cell neoplasms, there are various examples. One is the chronic lymphocytic leukemia. It is the acute lymphoblastic, because it is the precursor, so there would be mainly lymphoblast. So acute lymphoblastic leukemia. Whereas in peripheral B cell neoplasm, it is the chronic and it would be lymphocytic, much differentiated from chronic lymphocytic leukemia. And in the precursor T cell neoplasm, it is also it would be B-ALL and it would be T-ALL. That is T cell acute lymphoblastic leukemia. And in the peripheral T cell, there would be an anaplastic large cell lymphoma. This is the one example. There are many other examples. Anaplastic large cell lymphoma. And in the Hodgkin lymphoma, there are different classical and non-classical forms. In the separate lecture, we will discuss detail about this on the Hodgkin lymphomas. This was all about the WHO classification of the lymphoid neoplasms. Now we will mainly discuss first this acute lymphoblastic leukemia, B and T. Now we will discuss the acute lymphoblastic leukemia. The acute lymphoblastic leukemia, they are composed of immature B and T cell. Immature B and T cells, they would be called as pre-B cells or pre-T cells. Acute lymphoblastic leukemia, two types. Either it is B acute lymphoblastic leukemia or T acute lymphoblastic leukemia. So if there is B acute lymphoblastic leukemia, there would be pre-B cells, and if T acute lymphoblastic leukemia, then there would be pre-T cells. These are the immature forms of the B and T cell. Now, the B acute lymphoblastic leukemia, it mainly occur in children. So, it is a childhood leukemia. It is mainly the childhood leukemia. Whereas T cell acute lymphoblastic leukemia, it occurs mainly in adolescents. So it is, and mainly in the males. It is occur in adolescents. Why it occur in children and why it occur in adolescent age? Because in the number of normal bone marrow pre-B cells, they are greatest in early life. Okay, B acute lymphoblastic leukemia, it occur in children because in early age there are more pre-B cells in the bone marrow. That's why it occur in children. Whereas T acute lymphoblastic leukemia, it occur in adolescents because it is the age when thymus reaches its maximum size. So that's why the T acute lymphoblastic leukemia, it occur in adolescents as a thymoma or thymic mass. Now we discuss the pathogenesis of acute lymphoblastic leukemia. What is the pathogenesis? That why does it occur? It is basically due to the chromosomal aberration or chromosomal any mutation occur, due to which the transcription factors are affected. Mainly the transcription factors are affected, and these transcription factors, they are required for the maturation of B and T cells. So when these transcription factors, they cannot properly express and cannot properly function, then the B and T cells, they cannot transform into the next mature form, and the immature forms will continue to accumulate in the bone marrow. This was a brief pathogenesis of the, so there would be immature cells, number would increase. This was a brief pathogenesis. Now we will discuss the morphology of this acute lymphoblastic leukemia. Morphology. This. Mainly in the bone marrow. What happens in the bone marrow? Bone marrow become the hypercellular and packed with the lymphoblasts. What does it occur? In acute lymphoblastic leukemia, the bone marrow become hypercellular and packed with the lymphoblasts, the immature form of B and T cells. Now we will discuss something about the lymphoblasts, that what is their morphology, how they look like. I will draw a diagram of a lymphoblast. In lymphoblast, they are small round to oval cells, and the scant cytoplasm is present. Okay, not in a large quantity, a very scanty cytoplasm would be present. And the nucleus, its nuclear membrane, it is subdivided and cleaved. It looks like, the nucleus look like that it is a folded configuration, because the nuclear membrane, it is deeply divided and give a convoluted appearance to the nucleus. And in the nucleus, the nuclear chromatin, it is basically in the form of stippled and delicate form, because the chromatin is open, and in open configuration the cells are rapidly dividing. That's why it looks like this. And the nucleoli, the small nucleoli would be present, and it would be well demarcated by the chromatin. This was about the lymphoblast, its morphology, that there would be scanty cytoplasm, and the nuclear membrane would be subdivided and cleaved, and it gives a convoluted appearance to the nucleus. And chromatin, it is in open configuration and a stippled appearance, and the small nucleolus is present in the center, well demarcated. Now there would be multiple lymphoblasts would be present, other in the same configuration, and interspersed between them there would be the macrophages would be present, and these macrophages, they engulf the apoptotic tumor cells. These tumor cells, they would try to macrophages would try to engulf these tumor cells, and the apoptotic bodies would be present in the cytoplasm and of macrophages. This is the nucleus of macrophage, and these are the apoptotic tumor cells, and it would give a starry sky appearance to the macrophage. What is this appearance? Is starry sky. Look, as just multiple stars are present on the sky, just like that. The macrophage looks like that. This was the morphology of the acute lymphoblastic leukemia, that bone marrow become the hypercellular and packed with lymphoblasts, and these lymphoblasts, they their morphology is that the scant cytoplasm is present and nuclear membrane is subdivided and convoluted appearance, and in between these macrophages are present, and which have the apoptotic tumor cells which have engulfed those tumor cells and look like the starry sky. This was the morphology. Now we discuss the diagnosis, that how you will diagnose the acute lymphoblastic leukemia. What is the definitive diagnosis of acute lymphoblastic leukemia? Different stains are available, and these stains contain the antibodies. These contain the antibodies which are specific for the B and T cell antigens. The first method is by staining. These stains contain the antibodies which are specific for B and T cell antigens, and in this way we will diagnose the acute lymphoblastic leukemia. And the second is the histochemical stains. By performing these applying or using the histochemical stains, and two stains are used, two main stains. One is the myeloperoxidase and the second is periodic acid shift stain. Myeloperoxidase and periodic acid shift stain. These lymphoblasts, they are myeloperoxidase negative and periodic acid shift stain positive. Okay, in this way we will diagnose the acute lymphoblastic leukemia. I will repeat the definitive diagnosis, that how you will diagnose the acute lymphoblastic leukemia. One, by applying the stains which contain the antibodies which are specific for B and T cell antigens, and second by the histochemical stains. Two type of stain, myeloperoxidase stain and periodic acid shift stain. The lymphoblasts, they are myeloperoxidase negative and periodic acid shift stain positive. Now we discuss about the clinical features of acute lymphoblastic leukemia, that how the patients present when they are having the acute lymphoblastic leukemia. Clinical features. First is their symptoms appear abruptly, not a gradual onset. They appear suddenly, abrupt onset, just like a storm. Their symptoms, their symptoms appear abruptly. And the second, what are those symptoms? Mainly fever. They would be having fever, fatigue, and bleeding. What is the cause of fever, fatigue, and bleeding? Fever occur due to neutropenia or decreased white blood cell count. Fatigue occur due to anemia, and bleeding occur due to thrombocytopenia. Okay, because these lymphoblasts, they replace the normal bone marrow, and these other kind of cells, their deficiency occur, like erythroblasts, like thrombocytes. The mature forms of these cells, they are deficient in bone marrow because the bone marrow is now packed with lymphoblasts. So as a result, there would be fever, fatigue, and bleeding. These are the secondary effects. And then due to the infiltration of tumors into other viscera and structures like in the bone, they are rapidly dividing and expansion of the bone marrow, so the bone pain would occur. And in other viscera, their size would enlarge, so you will come across with splenomegaly and hepatomegaly. Splenomegaly and hepatomegaly. And due to spread to the CNS, and due to the CNS spread and meninges spread, there would be neurological symptoms like headache, like vomiting, like any nerves would be compressed. You will may come across with nerve palsies. This was all about the clinical features. Okay, fever, fatigue. Now, lastly, we will discuss the prognosis. Prognosis of the acute lymphoblastic leukemia. If the patient is having the acute lymphoblastic leukemia, what can you suspect that either this patient is having a worst kind of prognosis or a good prognosis? Then what are those conditions when the patient would be having worse prognosis or the patient would be having the good prognosis? We'll discuss one by one. First is if the age is less than 2 years. If age is less than 2 years, then the patient is going to have the worst prognosis, because less than 2 years there's strong association with the MLL gene mutation, and due to somehow if this gene is mutated, then the patient is going to have the worst prognosis. So the first first condition for the worst prognosis is age less than 2 years. Second is if the acute lymphoblastic leukemia, it is occurring in older age, that is adults. If it is occurring in adults or adolescents, then again the patients would have the worst prognosis. And the third is if the peripheral blood blast count is more than 100,000. If the peripheral blood blast count, these lymphoblasts, if we make the peripheral blood smear and we find that the peripheral blood blast count is more than 100,000, then it reflects that there is a high tumor burden and the patient is again going to have the worst prognosis. And what are those conditions in which the patient would have the good prognosis? If the age is between 2 and 10 years, then these kind of patients, they have a good prognosis. If the patient is have the low white cell count, if the low white cell count would be, then definitely there would not be a high tumor burden. And the third condition is hyperdiploidy, or if the patient is having the trisomy of chromosomes, that is 4, 7, 10. These chromosomes, if there is a trisomy and if there is a translocation, presence of translocation 12 to 21, these all patients have a good prognosis. So I will again give a review that what are the worst prognosis and which patients have good prognosis. If age is less than 2 years in adults and adolescents, and if the peripheral blood blast count is more than 100,000, these kind of patients, they have worse prognosis. But if the acute lymphoblastic leukemia, if it occurs between the age 2 and 10 years, they have good prognosis. And similarly, if the low white cell count and hyperdiploidy and trisomy 4, 7 and 10 and presence of translocation 12, 21, because these conditions, these hyperdiploidy, trisomy, presence of translocation, they would also the lifespan of the white cell would be shortened, so they would also be a good prognosis because there would not be a high tumor burden. That's all about the acute lymphoblastic leukemia, and thanks for joining.